almost every CEO from major pharmaceutical companies will stand up and pontificate the value of everything we do for the patient. And I think that patient infused is good, but we're doing things that involve high science, that involve genomics and involve immuno-oncology and things. So I'm not a fan of just sort of translating that consumer-centric experience to medicine. Like if I come into the hospital with a child who has cancer, I want the smartest doctor and the best therapy. I'm less concerned with the color of the waiting room and the ability to shake the hand that the physician is going to take care of. Now, I know that's controversial, but to me, I think that it's not just easy to lump into this consumer-centric. We're going to optimize the consumer experience, and that's going to fix our problems. That's not going to fix our problems. It's only going to take us to a certain point. If you can't fix my diabetes, or you can't fix my cancer, it doesn't matter how nice you are.
So me, I kind of agree, but for me, being consumer-centric isn't about changing out the clinical care, which I think is generally in good shape. It is about being more affordable, it's about being more accessible. It is, of course, keeping people healthy, because how more consumer-centric could you be than that? But for me, a lot of my focus is really on everything that surrounds and hopefully will help you navigate through clinical care, as opposed to being consumerist in how we deliver care. I think that's generally in a pretty good space. The opportunity, the pain points, the friction is everything else. So that's where I think, whether it's innovative or just being very simple and thoughtful, I think and low tech, there's a lot we can do.
There are sort of social determinants of health.
For sure.
We know that beyond your blood pressure and your blood glucose levels, there are functional aspects of the experience. If you can't get to the doctor, or if you can't navigate your way through a system, those are social constructs with clinical clinical consequences. If you can get people to take their medicine, if you can get people to go to the doctor, if you can do these sort of non-clinical social things, you can have a tremendous impact on care. And I think that's a real fundamental reality on cost too. Absolutely.